On the issue of public health, you've said this week that you would fire Canada's Chief Public Health Officer, Dr. Tam, for her handling of the pandemic. It's widely known that you disagree with many of the measures that were put in place. I wonder, though, whether Dr. Tam is the person to go after. What Dr. Tam provided advice to the government and evidence to the government, and the government made the decision. So why would Dr. Tam be the target of your frustration?
Well, it's not frustration. It's the abject failure of our pandemic response, namely that it appears that the response itself may have been considerably worse than initially thought, and that was the prevalence of my argument. COVID is a very serious infection, but that doesn't mean that we should not look at the collateral harm of lockdowns and other public health measures. And look, the government has always been acting on advice from the chief medical officer. That's what it's predicated its actions on. And we're seeing the fruits to bear. We're seeing a mental health catastrophe gripping our country. We know that our children have regressed considerably. We know that, according to the Canadian Medical Association, that already more than 4,000 Canadians lost their lives because of surgeries delayed. We have an almost doubling in the rate of deaths from overdose. In Ontario alone, we have more than 1 million cancer screenings missed.
I don't think anyone is denying the side effects of lockdowns. But I think you would agree, I would hope you would agree, that the tens of thousands of Canadians who died from COVID is also a tragedy and could have been worse if the lockdowns had not been in effect.
Well, no, I'm not. If we're here to relitigate lockdowns again, first of all, I welcome you acknowledging the collateral harm of lockdowns. That is something that wasn't permissible to even discuss when I discussed it first in January 2021. But the jury is still out on whether there's any efficacy to lockdown. We're still seeing a lockdown in some parts of China, 6th or 7th or 10th lockdown. What I suggest is that we should have focused our response on the vulnerable. We know that 80% of the risk was in long-term care homes and congregate settings. We know that the virus is very, very transmissible. And I'm not sure that it made sense to lock up 37 million Canadians and make themselves sick. There's nothing wrong with demanding accountability from our public health officials or questioning them.